Allergy is the most common health problem these days. Its individual reaction is different in different people. While one person is hyperactive to some articles, same time others are okay with those things. Harmless things become harmful. Immune system reacts an abnormal reaction or increased sensitivity to allergens, which is non-harmful to majority of people, according to Dr. Maka. Common triggers: dust allergy, food allergy, pollen, animal, dandelion, various drugs. There are numerous medicines or drugs which react negatively or badly in your body, and it develops various allergic symptoms. These allergic symptoms develop from this drug reaction. Paint. The color paint contains some chemicals which are allergic to some people. Fumes. Fragrances are part of life, but some get hypersensitive reaction with some fragrances of hairspray, soap, body and facial lotion, hair shampoo or conditioner, face wash, cosmetics, deodorant, and barber spirit. Cold air. Many people are hypersensitive to cold air or weather and show cold symptoms during season changing. Insect sting allergy. Most of the people are allergic reactions to insect stings. The majority of insect stings come from wasps, yellow jackets, and hornets. Cockroaches are crawling across your kitchen floor. They can be an allergy trigger. Their saliva, feces, and shedding body parts of cockroaches can trigger both asthma and allergies. Type of allergies are major 3 types. 1. Respiratory tract and throat allergy. Allergic rhinitis is allergy inflammation of the nasal airways. It occurs when allergens such as pollen, dust, or animal dander is inhaled by an individual with a sensitized immune system. It causes sneezing, itchy and watery eyes, swelling and inflammation of the nasal passages, and an increase in mucus production. Many of the same factors that trigger allergic rhinitis can also trigger an allergic bronchial asthma attack. Rhinosinusitis is inflammation of inner layer of nasal passage and inner lining of sinus cavity, resulting from allergic or viral cause. Common cause for developing rhinosinusitis allergy, in example, allergic rhinitis, most common symptoms are blocking of nose, heaviness, and severe pain on sinus areas like side on root of nose, both sides of nose, just under eyes, and maxilla portion of face. There sometimes is more nasal secretion, thin to thick discharges. Allergic bronchial asthma is chronic inflammatory disease of airways characterized by variable and reoccurring symptoms, reversible airflow obstruction, and bronchospasm. Symptoms include wheezing, coughing, chest tightness, and shortness of breath. It is triggered by various allergens or irritants. In allergic asthma, when the airways come in contact with allergens, the immune system reacts and releases chemicals. These chemicals cause the muscles around the airways to tighten. Inflammation, swelling, and buildup of mucus in the airways causes further narrowing. Allergic tonsillitis and adenoids. Tonsils are 2 round lumps in back of throat. Tonsils can be seen clearly on the back of the throat, while the adenoids are located high in the throat, behind the nose and the roof of the mouth, soft palate. Invisible. These are the lymph glands. The inflammation of tonsils and adenoids are called tonsillitis and adenoids. Common symptoms occur in tonsillitis, sore throat, cannot swallow anything because of pain, redness of tonsils, cough, and fever. Adenoid symptoms: snoring, sleeping disorder, weakness, feeling, etc. Nasal polyp are non-cancerous grape-shaped growths found around the nasal mucous membrane at the place where the sinus opens to nasal passage. They result from chronic inflammation due to allergy, asthma, recurring infection, or immune disorders. Common symptoms are blocked stuffy nose, postnasal drip, runny nose, loss of smell, pain in maxillary portion. 2. Skin allergies. Urticaria or hives is skin reaction of appearance of various sizes of smooth, slightly elevated pinkish patches of wheals attended with severe itching resulting from allergic reaction. Those are subsided automatically after a few minutes to an hour without leaving a scar. Most cases of urticaria self-limited and short duration. Chronic urticaria is defined as urticaria with recurrent episodes lasting longer than 6 weeks. Atopic dermatitis or eczema is one type of inflammation of skin characterized with itchy, redness, rough and cracked skin patches resulting from allergic cause. There may be wet, oozing, or sticky, watery fluid from that affected part. 3. GI tract allergy. Gastroenteritis. There is abdominal pain, nausea, and loose bowel movement. Generally occurs in children. Factors that can increase your risk of developing allergies include the following. Have a family history of asthma or allergies, children more susceptible. Cigarette smoke. Births during high pollen seasons. Those babies born during high pollen seasons may be more sensitive to hay fever allergens later in life. Allergen exposure. Early exposure to allergens like mold, pollen, dust mites, pet dander, cockroaches, and some types of foods seem to increase your risk of developing allergies. Being a bottle-fed baby. Studies show that breastfeeding reduces the frequency and severity of allergies in children. Being born prematurely. Premature babies have a higher risk of developing allergies later in life. Having one or more parents have nasal allergies. Children have allergies, just one of their parents have allergies. Then their risk is nearly 70%. Environmental issues, lifestyle changes, urban living, higher exposure to dust mites, atmospheric pollution, nutrition, lifestyle changes, maternal smoking, diesel fumes, geography, and hygiene hypothesis, the strongest risk factor for the development of allergies and asthma. Treatment for allergy. Before going for treatment of allergy, Dr. Maka says it is essential to know the basic thing, how the allergy occurs, and what is the scope of conventional treatment and homeopathic treatment. An allergy is a hyperimmune reaction of a person to many substances which are though safe for others but harmful to allergic people. These substances are allergen or antigen. There are various types of allergens or antigens present in the environment, such as dust mites, pollens, various foods, many drugs, cold air, strong smells of various substances like perfumes, petrol, paints. Those antigens or allergens, when entering inside the body, our immune cells recognize and eliminate them out. Our immune cells, like T cells, T lymphocyte, and B cells, B lymphocytes, play the major role to perform this task. In a normal person, when those antigen or allergens enter inside the body, the immune system eliminates them without reacting. But an allergic person of hypersensitive immune system reacts to those substances vigorously. A person of hypersensitive immune system, the B cells induces inflammatory tissue reaction called allergic reaction when they come in contact to antigens or allergens. The B cells of a sensitized immune system, when they detect any such foreign protein or antigen, produce certain substances called IgE antibody. In our body, there are cells called mast cells. Those mast cells contain granules called histamine and heparin. Around the surface of mast cells, numerous receptors are found called Fc receptors, to which the IgE antibody binds. When any allergen invades the body, The B cells identify the invader and produce the IgE antibodies that flow and attach with the Fc receptor of mast cell surface. The antigen or allergen further binds with these IgE antibodies over mast cell surface. This way of antigen-antibody fixation stimulates the mast cell to release the histamine content around tissues. Those histamines, which come in contact to surrounding tissue, bind to histamine receptors, H1 receptor, present over tissue surface and start developing allergic reactions. The symptoms of sneezing, runny nose, redness, and itching of eyes and nose are nothing but the outcome result of histamine. Dr. Maka homeopathy treatment helps to rectify or modify the sensitive nature of the immune system of an allergic person to give them a long-term cure. If one person's immune system has become hypersensitive, so under the background there must be something that has made it such like. So what are the things that have made the immune system so hypersensitive? Staying always in a stressful condition for weeks or even months produces cortisol, the body's stress-induced hormone. When cortisol becomes elevated and remains so for a while, it affects the cells that comprise your immune system. So prolonged stress condition can affect your immune system to become hypersensitive. When anybody is in a stressful situation, he or she may act differently to the stress. Some people feel hopeless and desperate from the stress. Some people feel frustrated, angry, or vexed by the situation. Some people feel to cry out loudly or even cry while sharing their matter. Dr. Maka searches out the exact reaction, what the person expresses or feels out of a stress, and accordingly chooses the medicine. This is just a single example of selection of remedy. Similarly, there are many factors needed to be considered to choose a suitable remedy for the patient. There are different types of emotions like sadness, anger, frustration, fear, apprehension. Some people constantly suppress their natural emotions due to some unavoidable circumstance, and that suppression directly affects an immune system. Dr. Maka tries to find out what is the exact emotional factor that has been suppressed and select accordingly one constitutional remedy, which helps to modify this immune system to work normally. This constitutional homeopathy treatment offers a long-term cure to the allergic patient.